My name is Carrie Rheingans, and I'm a graduate student at the University of Michigan for the next 13 days until I graduate. And I'm here to talk today about the Student Handbook for Global Engagement. And I have to apologize, I actually have to leave right from here to go to the airport. So I have some handouts and my contact information is on the board. So I encourage you to contact me if you do have questions or want to talk more. And I apologize, I have to take off right away. So, the problem that we were facing on our campus, it's a huge university. We have schools and colleges and departments that are in silos, they don't talk to each other, and there was different training for people to go abroad. Some had a checklist that was like, get this immunization and fill out this paperwork and you're good to go. Some people had intensive training where they had to take a class or something before they could work abroad. And I'm talking not just about research, but also about projects and internships and volunteering as well. So, we were a bunch of students at the new University of Michigan Center for Global Health. We got together and wanted to create a handbook that could kind of standardize some training across our campus, and that's where we came up with the Handbook for Global Engagement. These are the chapters in the handbook, and it's over 40 pages. So I mean, this is a pretty big, and it's all in color, so it's very expensive to print. So we've put it online at globalhealth.umich.edu. You can download it, but here we talk about project development and a little bit more of an ethical grounding than a lot of the training people tend to get. And we really wanted to make sure that people would understand kind of why there is such a history of making sure you have ethics when you do work abroad. The logistics section does have a bunch of checklists though, because we still like the easy checklist, packing lists and things. One really fun thing about this is it's open source, which is an alternative to publishing under a copyright. And our open source license that we use is the Attribution Non-Commercial Share-alike license, which means that people can take our work, they can change it, do whatever they want, make it useful on their own campus, and then they can publish it using the same license. And using this Creative Commons license, they must then use the same license. And since it's non-commercial, we don't make money, and people in the future won't make money on this, because it's just a bunch of student heads getting together. We all brain dumped and came up with the idea, so we don't think anybody should profit on that, especially at the expense of international partners who can't afford maybe to purchase a handbook for $200 or something. Open Michigan, that's open.umich.edu. They are a group that helps people find, use, and create openly licensed content, and it also gives a forum for people to share. So they've been helping us promote on our own campus and outside of the University of Michigan. But everybody's really excited that this is a for students, by students handbook. Some of the stuff that I hope that you can help me with today, since this is a social enterprise pitch and we get feedback from the audience, we're hoping, this is huge and costs a lot to print out, so we're hoping to make a field guide. We're not really sure what things to keep in there, what things to cut out, because this is a lot of ethical things in here, so it's not super practical necessarily, so we love figuring out what to put in the field guide. We would love to disseminate this to other universities, see what struggles you have at your university. Feel free, edit it, but remember the share-alike license. And then one thing that we are thinking might be fun, and also useful, is in the future if people at our university had to pass some kind of tests, online training modules in order to receive their funding from different departments, just to show that they have a little bit of the grounding and ethics that we as fellow students think that people need. For example, don't post photos on Facebook of a patient when you're doing surgery on them. Some people do that. So these are the kinds of things we're thinking of doing in the future, but we're open to other suggestions. This is open source, after all. And I would love to take questions. I know that we have time for that, but before I start, I just want to say, I don't know if anybody here knows Sujal Parikh. He was a student at our university, and he was here in the past doing a lot of global health work. And something that was on his Facebook profile after he passed away was a quotation by Claude Bissell, who was a president of the University of Toronto, that says, "Risk more than others think is safe, care more than others think is wise, dream more than others think is practical, and expect more than others think is possible." So I think all of us here at this conference can really go forward doing that in honor of Sujal and in honor of everybody that isn't here. So thank you.
Thank you very much.